I am Dr. Professor P.C. Manoria, Scientific Chairman, 3rd World Congress on Cardiac Imaging and Clinical Cardiology. All of us know cardiovascular disease, particularly coronary artery disease, is the leading cause of cardiovascular morbidity and mortality across the globe, more so in India. But during the last couple of years, there has been tremendous advance in prevention of coronary artery disease, and time has come to discuss whether the current science allow us to live for 100 years without acute myocardial infarction. Now we know that when we look at the issue of stabilizing coronary plaques, which are the culprits for acute myocardial infarction, in the current scenario, we can easily passivate these plaques by statin therapy. When we look at the second issue, can we arrest the progression of atherosclerosis? The answer is again yes. We have very good data from the reversal trial, where high intensity statin like atorvastatin arrested the progression of atherosclerosis, and this occurs at LDL level is less than 70. So the concept has emerged that if you lower LDL to less than 70, you can arrest the progression of atherosclerosis and myocardial infarction will be postponed. Still, the third issue is, can we regress atherosclerosis? Again, the answer is yes. We have very excellent data from the evolocumab trial, which shows that if LDL is slashed down to less than 50, atherosclerosis can be regressed. So at the present state of time, we are powered with very strong modalities of treatment which can arrest progression of atherosclerosis, which can regress atherosclerosis. So concept of emerging, does the current science allow us to live for 100 years with freedom from clinical coronary artery disease? So for this, you have to understand that myocardial infarction only develops when the exposure of LDL cholesterol to the arteriole reaches the threshold limit. The threshold limit is 7,000 milligram years, which means your LDL cholesterol is 100 from early age. The CHD threshold is 7,000. So at the age of 70, you will reach this threshold. You will develop myocardial infarction at the age of 70. Suppose you keep your LDL cholesterol to less than 70, the CHD threshold will reach at the age of 100. So now this concept is being actively pursued, and we have statin therapy. If you are able to lower down your cholesterol to less than 70, or we have other modalities of treatment also like ezetimibe, bempedoic acid, and PCSK9 monoclonal antibodies, and in times to come inclisiran will also emerge on this area. But the most exciting modality which is now on the horizon is the CRISPR technology for gene editing. And with this technology, you can produce a double-stranded break in the PCSK9 gene, and when this heals, it loses its function. So this modality is already being tried in an ongoing trial, and with this, the PCSK9 level slashes down to 90%, and the LDL drops to 68%. And this is a single sitting treatment. So in one sitting for the rest of life, your PCSK9 can be deactivated and your LDL cholesterol slashed down to very low level, and this is going to the future of cardiology. So if you want to live for 100 years, you have to postpone your CHD threshold to less than 7,000, which is possible if you lower your LDL cholesterol to less than 70, you are likely to live for 100 years with freedom from clinical coronary artery disease. If you slash down your LDL to 100, MI will develop at the age of 70 years. So the future of cardiology is to prevent coronary artery disease, because although we have excellent modalities, lifestyle modification, drugs, PCI, CABG, they no doubt decreases morbidity and mortality, but do not decrease the number of coronary artery disease patients. The number is progressive rising. So our aim is to stop coronary artery disease, stop heart attack, and this is only possible with primordial prevention, which is very difficult and has to be carried out for decades together. And the best subjects for these patients are nursery kids. It is seen if they are taught lifestyle modification at the school age, they continue to follow it. But still other method is you slash down your LDL to less than 70, you will live for a very long time with freedom from atherosclerosis, because atherosclerosis does not progress if your LDL is persistently slashed down to less than 70. Thank you very much.